Good afternoon, everyone. Welcome. We'll wait just a minute so everybody who was in the waiting room can get in. We are delighted to have another big turnout this afternoon. It has been good in these Dean's discussions to see people's faces. It's not as good as when we can be together in person, but it is great to see your faces this way. And we've had some really interesting discussions. The Dean's discussions over the summer have been about the pandemic, about race as well. We've covered a number of different topics. We actually have one more coming that I'll send an email message out about tomorrow. Today's discussion is about the pandemic and the threats to, but also opportunities for democracy. And the nature of Dean's discussions is we ask a few faculty colleagues to start the discussion by offering their perspectives briefly, and then we turn this open for questions and responses. So I'm very grateful to the faculty members who have agreed to lead today's discussion. We have, I think, in order of speech, Matt Baum, who is the Marvin Kalb Professor of Global Communications at the Kennedy School, Erica Chenoweth, who is the Berthold Beitz Professor of Human Rights and International Affairs at the Kennedy School, and Archon Fung, who is the Winthrop, Laflin, McCormack Professor of Citizenship and Self-Government. These folks are trained in political science, but work on a whole range of issues that are crucial for democracy. And as I say, I'm very grateful for their leading today's discussion. Our moderator is, as usual, Sarah Wald, who is my chief of staff and an adjunct lecturer at the Kennedy School and at Harvard Law School. And I'll turn this over to Sarah. Sarah, please.
Thank you, Dean. As usual, our format will be, we will hear from each of the three faculty panelists, and then we'll open it up for questions from the rest of the audience and the participants. If you would use the virtual hand raising, that would be best for asking a question. This is, as the Dean said, the fourth of 5 sessions this summer, which followed 3 sessions during the spring, all framed around different aspects of the pandemic, of the COVID-19 pandemic, from leadership during the pandemic to the economic consequences to gender in the pandemic, race in the pandemic, crisis response. And this one is obviously a major topic, which is threats to and opportunities for democracy in the broad framing of the pandemic, but there are also other crises going on, crisis of racial justice and other things going on that our panelists will talk about. So we're going to hear first from Matt Baum. Matt?
Oh, okay, that was quick. All right, so I think we were just sort of joking before that Erica and Arkhan are going to provide the hope, and I'm going to talk about the threat. So I guess that's going to be my hat today. So what I want to do is use the few minutes that I have at the outset to talk about a few takeaways from a series of surveys I've been conducting with some colleagues from around the country. We've been doing bi-weekly surveys in all 50 states, about 10,000 people a week. And I just want to talk about a few of the main surveys. And basically, I want to make the case that what we're witnessing in real time is a series of slowly unfolding, or what you might think of as creeping crises. So these are crises that are emerging slowly enough that it's not that nobody's noticing, it's just that they're not producing the sort of national urgency for kind of an all hands on deck policy response that the situations would seem to demand. So the first of these I would characterize as a broad failure of our democracy to translate public preferences into policies. This is most apparent in the top-down push we've seen from the White House and a variety of state houses for a rapid reopening of the economy, which has occurred despite strong majority public and expert opposition in nearly every state in the nation. We've polled them all repeatedly. Where this divide is most extreme in states like Florida, Arizona, and Texas, we're seeing the consequences of this in the form of an explosion of the virus and hospital systems that are rapidly approaching overload and various other complications. The second, which I think is very much a consequence of the first, is a widespread emerging deficit in public trust in democratic institutions. We've seen a steady decline of trust in our surveys over the last few months at every level, but especially at the federal level where the declines are the largest. But we've also seen them across every single individual public and private institution that we've polled. And this ranges from social media companies and banks to local governments to the White House and Congress. Ironically, the initial rally period early in the COVID crisis, when the public really looked to the government to see it through the emerging crisis, set trust levels so high that with a few exceptions, it doesn't look that terrible right now. But if we sort of project forward another few months, given the the trends that we're observing, if there were a second wave in the fall, we could be heading for a significant crisis of confidence in our democratic institutions. The third is an increasing divide in attitudes and behavior between what you might call proactive versus reactive states. The more proactive states, regardless of the party in power, have tended to see greater public compliance with public health guidelines, smaller resurgences of the virus, and less stress on their public health systems, and perhaps consequently, larger splits between public support for state and local government on the one hand and the federal government on the other. The less proactive states are confronting much more difficult situations with public attitudes regarding the performance of their governors and the president increasingly merging and becoming indistinguishable, more mixed levels of compliance by citizens, often varying widely within a given state. The fourth, I think, is a far less visible creeping crisis than the virus itself, and that's an emerging mental health crisis, especially among younger folks in roughly 18 to 24 age range. Half of these in our surveys express levels of depression severe enough to warrant referral to a clinician, and 1/3 of whom in our most recent survey said that they've experienced suicidal thoughts 2 or more times in the past 2 weeks. So the depression rate here is about 6 times the average rate observed over the past decade. The suicidality rate is about 4 times the average rate of the past decade. What all 4 of these have in common is that they're made worse, directly or indirectly, by what seems to be the proximate cause of the state of affairs in the US around COVID, and that's increasingly severe partisan polarization that has largely thwarted an effective coordinated national response. At the outset of our survey in April, we saw pretty small partisan divides and attitudes about the severity of the crisis, shutting down or reopening the economy, and compliance with public health guidelines like social distancing or wearing masks. Today, we're seeing partisan chasms in attitudes, with Republicans being far less likely than Democrats, and in many cases less likely than independents as well, to want to reopen immediately, far less likely to express concern over COVID, far less likely to adhere to the recommendations of public health officials regarding steps to mitigate the spread. Residents of the mostly Republican states with governors that have largely followed the rhetorical and policy positions of the president tend to have the lowest compliance with public health guidelines, even as in many cases they also express the lowest levels of satisfaction with their governor's performance. So for instance, you could compare Arizona and California. In Arizona, Governor Ducey was slow to shut down and quick to reopen, and the governor closely aligned himself from the outset with the president. Now that cases are soaring and the hospital system's in crisis, Ducey's the least popular governor in the country. In California, where Governor Newsom was one of the first to shut down the economy, they've also seen a substantial resurgence of the virus, but we've seen a much more modest decline in public support for the governor. Maybe ironically, the outliers today, where we see the highest levels of public compliance and support for the state and local governments, are in 4 states with Republican governors who were proactive early on: Maryland, Massachusetts, Vermont, and New Hampshire. Also bucking that trend to some extent is Ohio, where Mike DeWine remains about 20 points more popular than the president, and also Gretchen Whitmer, who's who directly challenged the president and is one of only 5 governors who's seen their approval ratings increase in the past month. So this is a politically diverse set of states. There are 3 of them are Democratic leaning, 1's Republican leaning, 2 of them are pretty closely balanced. What they have in common is a governor who took a different line than the president and his close followers, who tended to play down the severity of the emergency and advocated rapidly reopening the economy. But these are really the exceptions, I think, that prove the rule. And the rule today is that your party drives your information sources and your resulting beliefs, attitudes, and behavior. In the first case, information, Republicans are more likely to hold a series of misperceptions about COVID, ranging from belief in unproven treatments to belief that the virus was created as a bioweapon in a Chinese lab, a story that's been endorsed either directly or at least indirectly by a variety of Republican leaders from the president on down. Conversely, Democrats are more likely to believe misinformation consistent with their own partisan predispositions, like one rumor that President Trump was preparing to launch martial law in response to the recent Black Lives Matter protests. We also see strong positive correlations between mental health challenges and lower socioeconomic status on the one hand, and susceptibility to misinformation here and in other areas, such as ineffective treatments or at least unproven treatments, belief in their efficacy. So in this regard, I think COVID-19 has pretty much mostly brought into starker relief many of the patterns that misinformation researchers have been writing about for a number of years. In the second case, attitudes, Republicans are less worried than Democrats about COVID. They think it's less serious and that they and their family members are less likely to get it. As a consequence, they want to go back to their normal lives more rapidly. In the third case, behavior, they're considerably less likely than Democrats to do things like avoiding public gatherings, social distance, or wear masks. The other 2 dimensions I want to mention briefly are socioeconomic and generational. Both of these are obviously interrelated with party. There's actually new research suggesting that racial and partisan attitudes have become more or less the same thing in terms of predicting people's broader political attitudes and behaviors. We find wide socioeconomic and racial divides in every dimension of attitudes and behavior, as well as with respect to the governor's performance in a respondent state. Most of these issues are more severe among younger, less affluent, and non-white Americans. And all of them have fairly clear partisan implications, from how federal government relief is structured and distributed to how the resources states have devoted to the crisis response are allocated. So this is a way in which the emerging mental health crisis connects to polarization, as the types of challenges that are associated with depression and suicidal thinking are more severe given weak access to healthcare and other resources, unemployment, shut down schools, and all the things associated with the pandemic and exacerbated by partisan responses to the pandemic. So the bottom line is that we're witnessing a failure of democratic institutions to a degree certainly not seen since the onset of the Great Depression, which was a time when many Americans had all but given up on democracy. This failure has led to widespread resistance to and confusion about the necessary steps for protecting individuals, reopening schools, and safely restoring economic activity. And in this case, the culprit is pretty clear. As the crisis evolved from a national emergency to a partisan political emergency, the nation became incapable of offering a uniform, consistent set of policies guided by the best available science and expertise, leaving it to states, cities, nonprofits, and grassroots organizations to essentially improvise with radically different outcomes depending on their partisan attitudes and available resources. Many of them have done incredible work, but there's just no possibility that the hundreds or thousands of small atomized organizations can substitute for an all-out coordinated response by our national institutions. After all, that's why they exist. If there is a genuine second wave in the fall, it's going to come in the face of public institutions that have thus far largely failed and may find themselves in their own state of effective lockdown based on partisan calcification, yielding wildly different approaches in Democratic versus Republican states, likely with wildly different outcomes. So the bottom line is that short of an effective vaccine that a very large majority of Americans are persuaded to accept, despite the fact that in our current surveys, about a third of the public say they won't take it, period, full stop, the only way out of this situation is to find a way to depoliticize public health and take the pandemic out of the realm of partisan warfare. Not an easy task, but I would argue an essential one. And I'll stop there.
Well, thank you, Matt, for that quite sobering framing of the problem to begin with. Arkhan, I think, has some flashes of optimism. So let's hear from Arkhan, and then we can discuss it at the end.
Yeah, some optimism, some caution, some counterpoint, some large agreement with what Matt said, but also some counterpoints. I want to touch on basically three themes that that I'm taking away so far from this crisis, which is changing every day. My thoughts may be very different in a couple of weeks. The three themes are humility, that's number one. Number two is democracy rather than trust in the big state, big science, or technocracy. And the third hopeful part is a civic federalism. And the first theme is humility. And I think that democracy requires citizens to be humble. And this pandemic has been very, very humbling to me and almost everyone who I know who's made some prediction. That prediction has been incorrect at major points. And it shows the limitations of public policy and human agency in the face of this awesome force of nature. And one element of humility that touches a little bit on what Matt said, I think maybe a little bit of a counterpoint, but is in some agreement. I've heard lots of friends and colleagues and people around the Kennedy School in the last couple of weeks say, hey, look, this is a Republican issue. Look at the resurgence of the virus in these places where there's a bunch of Republican governors and red states who just don't believe it's a problem and are ignoring the science. But, you know, if you look at the highest per capita infection rates among states, number one is New Jersey, number two is New York, number three is Connecticut, number four is Massachusetts. And that may change, but that is what the status is right now, right? I mean, so it's not simply a blue-red capability in dealing with the virus. I just reject that. Trump likes to call it the Wuhan flu. I might call it the Cuomo flu, because I believe that the Massachusetts issue was in some measure an outflow of the failure to control the virus in the early days and the denial of the virus in New York by de Blasio and Cuomo. And a second point of humility is I think that I really hope that one lasting effect of our experience of this virus will be to decenter American public policy responses and turn to look at other places, which I think have done much better than the United States. Singapore comes to mind, South Korea, Hong Kong, and probably Germany, at least so far. So I think humility is one thing I'm really taking away, because many predictions, many thoughts and commitments that I've had, that my friends have had, that many experts have had, they've just turned out to be wrong, and they will continue to be wrong. So we should be more open-minded. Following secondly on that is, I think it's very tempting in the face of a public health crisis like this to say, let's do what competent government technocrats recommend. Let's do what the big state recommends. Let's do what big science recommends. I have a different view, which is I like democracy a lot. And by democracy, I mean a kind of give and take, a participatory democracy, and in which lots of people are debating what the best way forward is and challenging the conventional wisdom of the time. The biggest argument for this comes from Amartya Sen in an article he wrote in the 1980s. And he was looking back at India, and he said, well, why didn't India have any famines after independence, after they became a democracy? And then he got more general about it, and he says, well, why don't democracies have famines? And his thesis was, every country has bad leaders, but if you have a democratic system, the leaders know that there's at least a minimum check, and they have to prevent horrible things from happening. So, you know, for those fans of trust in the big state, imagine the big state and Trump is head of it. without any democracy, right? At least I believe that the democratic dynamic forces our political leaders to take the pandemic more seriously than they otherwise would. And that goes for our president, that goes for the UK leadership, that goes for many, many others. Drilling into the details of what has actually happened over the past 2 or 3 months, I'm cognizant of the many turns in which big science has gotten it wrong. The very first of these was the CDC's insistence that they be the sole provider of tests that turned out not to work and delayed the availability of testing in the United States by 3 or 4 critical weeks. Second case was there's a very interesting virologist at the University of Washington named Trevor Bedford. And he said at the probably 3rd week in February, he sequenced the first few cases from Washington and found that there had been community spread. That was his finding. And at the very same time, the CDC was announcing that there wasn't any community spread in the United States yet, that the problem was still external. And by the way, patient number 2 in Washington State was found because a scientist at the University of Washington operating in defiance of university authorities and state health authorities insisted on using her test to see whether or not somebody had coronavirus in her study, and they did. So patient number 2 was discovered in defiance of the authority of state regulators who told her not to look. Remarkable. The third case of big science error is the mask advice from WHO and CDC, which changed, I believe, about a month ago. And up until that time, they were saying, don't wear the masks because they're not going to help you. And, you know, there's a lot of reasons why they might have offered that guidance. I believe the guidance was offered in part because, yes, they thought that there wasn't asymptomatic spread, but I think it was a kind of leadership noble lie to prevent mask shortages. They were afraid if they said, yeah, maybe use some masks, they might help you, they might not, science is unclear, there would have been a run on masks and there wouldn't have been enough for health professionals, right? So that is oftentimes, public health professionals, other professionals are oftentimes afraid of a public panic. And so they kind of nudge in ways that make public panic less likely. I think in this case and many others, you should just be straight with people and say, hey, look, you know, we're not sure the masks will help. We know that the societies that are doing really well on this are mask wearing societies in Japan, South Korea, Singapore. They seem to have it under control, but in the West, we don't like masks. But, you know, if you want to be careful, wear the mask, but also know that health providers need them a lot more than you. So don't wear the N95s. That's not what they said until pretty recently. The current debate is about whether or not it spreads via aerosol. As people who've been following this know, there's been a big scientific letter to the WHO saying, hey, look, it probably spreads via aerosol. WHO has resisted. And so all of this is to say that your 6th grade picture of science as being immediately responsive to evidence, I don't accept that picture. I think science is a debate in which people with egos and entrenched positions argue it out with one another. That takes a long time. A democratic process, I believe, is one in which that argument can be accelerated and evidence brought to bear quicker than one in which that is relatively less democratic. And then finally, I think a 4th contribution of democracy to the pandemic so far has been to draw attention to the unequal health burdens brought out in the pandemic. We know now that Black and Latino infection rates are about 3 times the rate of white infection broadly in the United States. And of course, the health burden is very, very disproportionately falls on communities of color and low-income communities. And I believe that an open society that allows advocacy and discovery is much, much more likely to surface those inequalities compared to one that's less democratic. Third feature, and this is kind of my hope, one hope, governance hope for what comes out of this is a kind of civic federalism. And from the very beginning of the pandemic, I've thought this is, to the extent that there's any governance bright spot, it's going to be state and local. It's going to be federal. Early on, I think friends of mine that I was talking to said, well, one lasting effect of the pandemic is going to be centralization and confidence in centralized government. And I think probably not in the United States, probably not in a lot of other countries either. Even in Germany, a bunch of the success of the response is because of their federal system that allows a couple of things. One is appropriate local responses. Remember, in the first part of this pandemic, the deep red counties had very, very little coronavirus. And so, you know, you kind of want to take that into account. You don't, right? I think if you're a political leader or a citizen, you actually want to take the facts on the ground into account. And in a vast country like the United States, the facts are going to vary from ground to ground. And so civic federalism is kind of a Tocquevillian idea that if we're going to deal with this, it's going to be an all hands on deck kind of effort. It's going to be businesses, it's going to be community organizations, it's going to be a government that works, it's going to be attentive to evidence, even though knowing that there's always going to be serious debate about what the evidence implies among well-meaning people and even expert scientists. The federalist part is there's going to be great variation from state to state and community to community. And looking back, I think the test is going to be which communities were able to muster that inclusive, evidence-based, problem-solving, all hands-on-deck community. And I'm actually pretty proud of Massachusetts so far. The future is hard to tell, but I think we did pretty well on this. And remember, the leaders in actually shutting down in May were, first of all, I think higher education institutions, Harvard and MIT were at the very front of that, then local school districts, along with some businesses, and then the state, right? So it's the opposite. And this was true just about everywhere you look. It's not the governor, it's not the president saying, we got to shut this whole thing, the damn thing down. It's local initiative, spotting the areas of weakness, shutting it down, and then that spreading and then causing a larger response in the whole system. And then, so again, my hope is that when we look back, people will see that the states and communities that manage this well over the long haul, over a year-long period, maybe a 2-year-long period, will see that it was an all hands on deck, a local to state level response, and they'll look at those places and say, that's the kind of governance, society, and government and community that I want to build.
Thank you, Arkhan. Lots to discuss afterwards. So our final faculty expert speaker is Erica Chenoweth, who's going to pick up on some of these themes of participatory democracy and talk about social movements and how the pandemic has affected those and what we're seeing now that might be different from in some other movements. Erica?
Great, thank you so much. And thanks to everybody participating today in this conversation. Like Sarah said, I want to pick up on this theme of participatory aspects of democracy. Archon elsewhere has been fond of saying that the word democracy itself means people power. And I want to just situate the current state of American democracy in a broader global conversation about the state of democracy elsewhere. So many different scholars of comparative politics have been debating, but largely coalescing around a consensus that democracy worldwide is in crisis, that levels of polarization are at dangerously high levels in many different erstwhile established and advanced democracies, that levels of inequality are quite high in many places around the world, in most places around the world. And indeed, that there's been a real crisis of confidence in establishment political parties, established institutions, and even opposition groups that have long histories in societies to effectively manage and cope with complex policy problems and matters of public concern. So many scholars have noticed over the past 15 years this kind of global recession in democracy, so much so that many different comparative politics scholars are now really ringing alarm bells about the fact that democracy as a principle and as an institution is in major crisis. So this should cause us to ask what can be done when democracy is in crisis. And there are some scholars named Steph Haggard and Robert Kaufman who actually studied what happens when countries begin to backslide into authoritarianism that prevents them from tipping over. And there's another book that many people might be familiar with called How Democracies Die by some other colleagues, Steve Levitsky and Daniel Ziplat, who argue that when democracy begins to corrode, it usually does so internally because of the lack of respect for democratic norms. That is to say, executives begin to practice the full expression of their power and begin to eschew and ignore constraints on their power that others have voluntarily imposed on themselves. And Kaufman and Haggard, in their book called Dictators and Democrats, argue that this is not just true, but that once democratic recessions begin to take hold, democratic institutions, the separation of powers, for example, become basically irrelevant in preventing the tipping over into authoritarian politics. And part of this is because of the crisis of confidence in those institutions, but part of it is because those institutions are co-opted by autocratic leaders and no longer provide effective checks and balances on their power. So what does that mean? It means that there's really only one kind of final check on authoritarian encroachment, and that's civil society or people power. And this finding really links into lots of other scholarship that makes the argument that people power, particularly popular protest, is a good thing for democracies. It's a good thing for democracies because it creates a bottom-up check on power, particularly for elected officials who are very responsive to their constituents expressing their discontent. And it actually is a way for constituents to create new agenda priorities, to frame issues in ways that force public attention and official attention on these issues. And in many autocratic regimes, it's actually the only way that people are able essentially to create real cost on the regimes. And so what we should be concerned with then is the capacity for civil society and communities around the world and in this country to effectively create that check on autocratic backsliding. So with that context in mind, when the pandemic hit, it's important to note that we were experiencing the largest wave of mass mobilizations around the world that had been recorded in history since 1900. So just in the past decade, which really began with the Arab Spring uprisings, there had been 90 mass movements around the world for democracy that were demanding that autocratic or semi-autocratic leaders leave office because of their authoritarian impulses in the last 10 years. So 90 such movements around the world that were nonviolent, popular uprisings, demanding leadership to leave office because of authoritarian tendencies. And there are only 195 countries. So this is a sizable proportion of the world's population that was involved in such uprisings. And at the end of 2019, there were dozens of these movements ongoing in Hong Kong, in India, in Lebanon, in Sudan, in Algeria, where these conflicts are very much alive. And so there was real concern when the kind of global shutdowns began related to the pandemic, that the pandemic was going to be used by these leaders to essentially shut down street demonstrations and popular protests in ways that would, demobilize them, remove their momentum, and make any meaningful attempt to bring leaders to account for autocratic tendencies become easy to spin as kind of unfair or below the belt political maneuvers during a time of collective crisis. And, lots of different observers were even saying the pandemic and COVID have killed street demonstrations as a method of popular participation. So a couple of my colleagues and I started to collect data on exactly what was happening around the world, if not street protests. And actually we found that there were over 100 different new techniques of nonviolent action that people were innovating during this period. So it may be true that it was often that street demonstrations were becoming less common because of the need for social distancing, et cetera. But in February and March, we observed about 115 new techniques, from car caravans to different types of socially distant protests to forms of online activism, to all kinds of different community organization or mutual aid associations that popped up and flourished during this period. And part of the reason why we should really care about these types of tactical innovations is because it's actually the case that street demonstrations themselves are usually not the most effective tactic related to popular uprisings. More effective tactics are forms of non-cooperation, like strikes, stay-at-homes, and boycotts, and different forms of alternative institution building, exactly like these mutual aid associations, which are forms of kind of supercharged social capital, very high stakes forms of community engagement where people are practicing active concern for others. They're taking some civic responsibility. They are providing food, shelter, money, errand rides, and other types of ride shares to their neighbors, which establishes a sense of reciprocity and voluntarism, and gives people a sense of kind of civic or collective claims making capacity that then can lead into other forms of mobilization. So this is to say that even as street demonstrations demobilized, other forms of tactics began to emerge. And this is really crucial, I think, in helping us understand why, now that people are either slightly reopening or even taking to the streets in places that aren't fully reopened yet, regarding racial justice protests and the anti-racism movement of our time, is because mutual aid organizations and community organizing is a critical source of resources for mass mobilization that many movements had sort of not developed over the past few years. So a lot of movements would kind of organize street demonstrations and street protests, and that would be the only tactic that became really common, where these other forms of organizing give them the capacity for much longer term and more sustained mobilization. So let me make my third point and final point before we go to the question and answer, which is that our current moment, it's really important to notice that we are actually living through the largest and most sustained civil rights uprising that we've recorded in US history. And we know this from data on how many protests are happening around the country, as well as how many people are participating in those protests. In data that I and my colleague Jeremy Pressman have been collecting through the Crowd Counting Consortium, we've counted 5,000 distinct protest events from the last week of May through the third week of June alone, and that's with about about twice as much data still to code. There are millions of people who've been involved in the protests around the country, and surveys reveal that anywhere between 10 and 24% of Americans have participated in a protest for racial justice since May 30th. So that's a wide range, between 10 and 24% of Americans. So let's say that half of those people weren't telling the truth. That still means that 5 to 12% of Americans say that they have participated in a racial justice protest in the last month. That is a higher rate of participation than we've ever seen in any form of collective mobilization in this country. And to put it in context, the Women's March of 2017, which at that time was the largest single day mobilization in US history, brought out about 1.8% of Americans that day. So we're talking about a movement that kind of blows that one out of the water in terms of popular participation. And the reason that this time is also different is a qualitative difference about who it is, who's participating, and who's showing up for this. So surveys also reveal that the primary organizers of these protests and demonstrations are people who are under 35. They are, about half of them are saying that the protests that they've organized are the first protests that they've even been to. The other half generally say that they have participated in previous protests, and because of their youth, it's often either other Black Lives Matter protests or the protests for gun control that were related to the events after the Parkland shooting in 2018. For example, in research in Pennsylvania, we found an incredibly high correlation between school districts that had held a Parkland walkout on March 14th of 2018 and racial justice protests since May 30th this year. So this is really truly kind of the Ferguson Baltimore generation that we're seeing mobilizing today. And the reason this is really important is because many people have argued that lack of youth participation in politics is part of the reason why there's so little confidence in democracy and why democratic policies tend to not reflect the concerns of youth. They tend to vote less than other blocs, et cetera. And this time we're seeing that not only are youth engaged in this way, but also the way that they're engaging is calling for broader forms of civic engagement and participation, including voting. So much of the kind of organizing activity that's taking place right now around the movement for Black Lives is focused on the November election. And I think that's very consequential and is a departure from previous protest uprisings. We know that mass mobilization of this kind has major effects on electoral outcomes when people are allowed to vote or able to vote. And that sometimes it's indeed these protests that provides the opportunity for voting. There are very few times when social movements can actually choose the political opportunity structures in which they are operating. Voting is one of those ways when movements can make a difference about which political opportunity structure they are operating in. And that's exactly why it's an often wise strategy to focus on electoral mobilization 4 months before an election. So with that, I just want to end on this sort of maybe more optimistic note, depending on how you view these things. But this is to say, I have confidence in this movement because I've been spending much of my time over the past few months reading stories about children organizing marches and 150 people showing up for their march and holding signs about unity, kindness, and justice for all of the people in their school. I think that if this moment creates opportunities, motivations, and sustained interest in people taking responsibility for their communities and the sort of welfare of everybody that they live near, I think that we are going to come out of this better than we went into it.
Thank you. We're going to open it up to questions now. And just to remind everyone what a good question at the Kennedy School is there's one question, it's brief. There's only one question. We're not going to do follow-ups, and it ends in a question mark. So let's see, we'll go, and please use the virtual hand raising. The first one I see is Harrison Mann.
Hi there, thank you all. This is mainly for Professor Baum based off some of the statistics that you were talking about in your studies. You mentioned that there was a big correlation between states that were not proactive and then lower approval for those governors and the president. I'm wondering if that reflects people who are simply basically lost hope with government and don't approve of anything and basically are going to kind of sit out future elections because of the inaction they've seen with COVID, or if you expect that those are people who are going to vote out the elected officials they feel brought them there, and if they're making that connection.
So that's a really interesting question. I think it's sort of complicated and there's no one answer to that. A lot of the states where we're seeing these declines are sort of Republican-leaning states in the South and the Southwest. What we're seeing so a number of these are the states that we're hearing about in the media have gone from solidly Republican to lean to now toss-up. So the evidence suggests that people are moving or sort of following the expressions on dimensions like trust and support for how the government, either the local government or the federal government, are handling COVID, are actually sort of percolating through to what they're planning on doing in the election. It's difficult to know whether ultimately there's also going to be an unfortunate demobilizing effect of just sort of a pox on all their houses and hopelessness. It doesn't seem like that. It seems like there's a lot of energy around the election. One of the things we're polling right now is people's attitudes on things like vote by mail and whether or not they would be, whether or not they feel safe to vote and how important it is to them, even if, pandemic is still with us. And we see really high levels of support for all different measures to try and make voting easier in these very places. So there's only one state, I think, where less than a majority of the public support easier access to vote by mail among states that don't already have universal vote by mail. So I would say the indirect preliminary signs to me are not people sort of walking away from politics, but people sort of being really sort of this initial increased faith that, in a crisis, we look to our leaders to protect us. That's sort of, the floor got pulled out from under a lot of people. But I think it's being directed right now at the people in power, not the system.
Erica or Arkhan, do you want to add to that? Arkhan, do you have any?
No, I think that's a good answer. I don't have much to add.
Okay. The next question is Michael Kalanti. Michael, are you here?
Yes, I am. Can you hear me now?
Yes.
I'm sorry, I'm still getting used to this. Hey, folks, Mike Kalanti, I live here in Boston. So my question is, so I've worked actually on pandemic planning at the local, state, and national level. So to be on this side of the aisle right now is very odd. I wrote many of our pandemic plans for the city of Boston as we rolled into this crisis. And one of my major questions is, this is the first time in American history we've had a 50-state disaster declaration at the same period of time, but yet are not following national response plans that had been created by Health and Human Services, Department of Defense, FEMA. And we've seen kind of the consequences of that. States fighting over PPE, the actions of one state bleeding into another, and us needing regional governance structures to kind of try and figure out what to do. But the thing that really got to me, Professor Baum, you mentioned this isn't a seismic event in the sense of being a 9/11 or a Katrina with a, it happened, we have the visual, we're going to recover, and we can have a sense of what that might look and feel like, even if it's traumatic. This has not gotten the big, bold policy responses that are going to be required, I think, to mitigate the long-term impacts of this. We are still in the crisis. We are trying to recover and respond at the same time. And I worry and I wonder what you think about how we mitigate the crises that we could be dealing with for the next 2, 4, 5, 10 years with examples, like you said, around mental health or childhood education, the things that are not going away. And in some instances, we're creating more inequity with our responses of pulling kids out of school or underfunding those social service institutions that are going to be paramount to recovering as the demand for those services rise. So maybe if you could speak to the ongoing threat.
Yeah, I mean, I think we're flailing trying to figure out how to do things like, what do we do about the schools? Because we can't restart the economy unless the kids are back to school, but we have no formula for putting these kids back in school safely. And there were guidelines, and the president didn't like the guidelines, so they were going to revise the guidelines, but then the next day they're not going to revise the guidelines. How do people know what to listen to? So to some extent, I would align my response with the story that Archon was telling, which is that the answer is not going to be a uniform long-term plan from Washington. I think part of the answer is certainly going to be spend a lot of money and bring to bear the best national expertise. Certainly that's a piece of it, and I think it's inevitable that we're going to do that. But I think we're in for a long, slow slog to try and unwind the mess that we've put ourselves into. And we don't even know if we're at the bottom. We really just don't know. Hopefully we're at the bottom and we can start pushing out of that. But I think this is going to take the kind of participatory citizen democracy, sort of pressure from above and below simultaneously over a very long sustained period of time. I mean, look, I have, I know Arkhan as well, and a lot of you have young kids that are really sort of, I'm sort of in a slow boil of panic about what's going to happen with my kids' education. Another year of this, and it's going to be, when are they ever going to learn if we have to be the educators? So the mental health crisis, similarly, we need major investments in community mental health, community-based mental health. We need to find a way to get students back to colleges, because for college students, college-age students who are enrolled in colleges, that's the most important provider of mental health services, and they're mostly shut down. So, you know, we have to either find a way to get them back there or find alternative resources that, you know, places that they can go. And, you know, I don't think we have really a good set of plans for all of these things. And I think it's going to take a long time. But anyway, that's a really long-winded answer to your question. I apologize.
Arkhan, do you want to?
Sure, I completely agree that it's a really long time. I think the Churchill quote has been going around that this isn't the end, this isn't the beginning of the end, but this might be the end of the beginning. Kind of feel like that. I think it's in for the long haul. There's a really interesting article in the Boston Review about how pandemics end. And the upshot is there's no silver bullet. It's rarely the case that in past pandemics, you develop a vaccine and then it goes away. Even that is local, because as Matt said, different communities, different states decide to vaccinate at higher and lower levels. A frequent kind of end to the pandemic. It's a little bit like gun violence. We just get used to the death. It just normalizes. A third kind of end is a slow boil that trickles away. Think about AIDS, HIV, right? Is a pandemic that took a public health disaster that took a long time and has no sharp end, right? It has a very, very long tail. I would love to see more national coordination. I am a little bit skeptical about the quick ramp ups, right? I mean, the response to September 11th got us into America's longest war. The Liberty ships of World War II that everybody talks about, you know, as a PPP analogy, if you look into that, the first ones all broke in half because the steel was crappy, right? And so like the idea of these big centralized immediate response, I think the space program was a good one. That actually, I like that one. But you know, it's not, you know, batting 1,000 in that zone. So I guess I think that the longer term response, I really hope, you know, Matt's right. And I kind of think you are right that maybe what the future holds is a large spending to take care of a huge amount of the social and economic pain that's coming. I'd love to hear Doug's views on this. I mean, he knows more than anybody on this panel about whether or not that's likely to happen. But, you know, I hope so, because there's going to be a lot of pain. But I guess I think this is the end of the beginning part, and all that continues. And, you know, another path is society's we end up being indifferent and don't spend that money. And a bunch of people end up really suffering because of it. I mean, for me personally, one of the bright spots, not right. I mean, the crisis has occasioned some conversations with colleagues like Latasha Brown, Black Voters Matter, working in the South for very low income communities of color. And she says, look, you know, in my community, Black workers have been disposable for a long, long time. And, you know, there's no automatic reason why they should become less disposable because of this thing. And the best we can do is like shine a light on that and try to make it less the case. So, you know, there are dark possibilities with regard to inequality and suffering as well.
Okay, next question is from Catherine Sickink. Professor Sickink, are you still coming to us from Uruguay?
I am, but I'm glad to say we finally found a flight back, and we'll be back.
We're happy to have you back.
So, well, first, I just want to say that this discussion, as these discussions often are, just this is a great discussion. Thank you so much to the speakers, and it reminds me what I love about the Kennedy School. And I have two kind of quick questions. One I think is for Archon, but others, and that is, what about such concerted voter suppression efforts, despite everything that I really support that you have said? What about such concerted voter suppression, the kind of thing we saw in Kentucky, right? Where just the government decides to put so utterly inadequate number of voting booths out that people just won't be able to vote. And then a second quick question, this is for Matt. 1/3 of people say they won't vaccinate. What's that about? That's way higher than the number of anti-vaxxers we have. So the country's becoming deeply more opposed to vaccination? Is that what you're finding in your polls?
You want to go first, Arkhan?
Okay.
Sure. You know, Catherine, I guess I think that there's many depressing and sad things about American democracy right now, but to me, probably one of the saddest is the way in which the franchise itself has become a polarized issue. You know, historians, Alex Kazar, our colleague and friend, will tell you, well, it's always been a fight over who has the franchise and who doesn't. But at least for about a good 10 or 20 years there, I thought there was kind of sort of bipartisan, widely shared, capital A commitment to as many people voting as possible being by and large a good thing. And that is becoming less and less the case. And, you know, the idea that everybody should vote or everybody should be able to vote is itself becoming a partisan fight, which is really tragic. And, you know, this is distinctive to America right now. I mean, it hasn't quite the fight to win politics by restricting the franchise, by choosing who gets to vote, hasn't gone to Europe or the UK, and hopefully it won't. I mean, it's our problem right now, and it's a terrible one. And I think, you know, one strategy is to try to somehow make that value that everyone should be able to vote, that everyone should vote, universal again, whether you're a red, blue identifier, Martian, green, purple, whatever, you should have that commitment. You know, I personally we haven't talked about this, but I personally am taking more of an attitude toward the right to vote that some advocates like the NRA take toward the Second Amendment, right? I mean, like, ID check is like taking away my extended magazine. I mean, that's like not going to happen. I think we just need to be more committed to this value that everybody should vote, and that people who would deny that value and who would use public policy to restrict it care more about perpetuating their own power than about American democracy. And that's an insult to the American democratic system. I really believe that.
So,
Matt, vaccines?
Yeah, well, I want to just quickly follow on with what Arkhan said, because I actually am really worried about how this is going to play out in the election. We're polling on those questions. I don't really have a strong answer yet, but my preliminary sense is that there's a chance we're going to have a tsunami of turnout because of vote by mail. It's unclear how that's going to play out, but I believe that the White House is laying the predicate to challenge the legitimacy of the outcome as a consequence of that. And, you know, I don't know if people have read Tim Wirth's nightmare scenario, but that's been literally keeping me up at night some nights. I won't go through that now because I want to get to the other question, but if you want to scare yourself some more than I already have, read that. On vaccines, actually, we've also asked about the flu, and we're right in line with typical responses to the flu. We're within 1 or 2% of sort of recent years flu vaccine rates. So I think what's happened is this has become polarized like everything else. So you have polarization mixing with the anti-vax movement, and sort of I don't know yet whether this is a reliable trend or just a one shot. I mean, this result is, you know, in the latest survey, which is, you know, it's a big survey, but it's only one point in time. It's not a longer term trend. So I hesitate to say that people are becoming more suspicious. I just think that the price of having, and I would say, you know, Archon talked a lot about the CDC. I think the problem is the CDC is under a lot of political pressure. And the price of having, you know, the big medical institutions under political pressure that we all saw in real time in the White House press briefings, and we've seen in the sidelining of Dr. Fauci periodically, and just the facial expressions of the members of the White House task force when they're put in front of a microphone and they can't contradict the commander, the president. So all of that is causing people not to know what to believe. And I think when you talk about the vaccine for the pandemic, then this is all getting intermingled together, and I think depressing it further. It remains to be seen whether at the end of the day, you know, it's going to sort of dip below regular vaccine skepticism. But I would say that vaccine skepticism in the US is extremely high relative to the rest of the world, and dangerous and worrisome. So even if it's exactly on line with the flu vaccine, that's still worrisome.
Erica, do you have anything to add, particularly on the voting? I was actually struck by what I heard was your confidence that, particularly for younger participants in the grassroots movements, that was going to translate into voting. Is that your view?
Yeah, I think it will make a difference. Of course, the big unknown always is turnout on the day that it matters. Nobody knows this, so you can look at the polls all you want. You can look at polls that actually accurately collect information at the state level. But when it comes down to it, it's all about whether votes are cast and counted, and nobody knows that. It's the big question mark. But plenty of research suggests that higher levels of protest in a country in advance of elections play a major role in increasing turnout. And part of that is because it increases enthusiasm. Part of it is because it increases organizational capacity, resource, and commitment to getting the vote out. And part of it is because you know, basically people feel, if it's coming on the heels of a social movement, they feel like they've already taken more costly and risky actions than voting to participate directly in the outcomes they wish to see. And so voting is actually one of the relatively lower cost things they can do. So turnout and suppression efforts are the two things that I think are keeping everyone up at night. But for me, turnout is a little bit of less of a concern than suppression efforts in this election.
Great. Next question, Sophie Dover. Hi, Sophie. Are you still here?
Hi there. Yeah, I'm here. Can you hear me?
Yeah. Mostly, yeah.
Okay. So this question is for Dr. Chenoweth, but Professor Fung and Baum as well, and builds off what we were just talking about. But I was struck by what you introduced, Professor Chenoweth, about civil society and citizens organizing really being the last and a really fundamental check on moving more towards autocratic leadership. And I am hopeful as well that like the uprisings that we've seen and the organizing that we've seen will translate to votes. But I'm also concerned that organizing has been portrayed and maybe perceived as undemocratic and un-American, and I think is like exacerbating a lot of the not only political but racialized divides that we have inherited in our country. And so I'm wondering how you see perhaps less the voter turnout, but like the narrative moving forward, and you know how we as Americans, and I apologize, this is less of a globalist approach, but how we as Americans can change the narrative, especially when the portrayal of protest is often backed by state violence and racial division. And what you think about that?
Yeah, that's a great question. So there is a literature on authoritarian politics that focuses specifically on what people call the authoritarian toolkit for suppressing dissent. And there are basically 11 or 12 incredibly common behaviors of authoritarian regimes and some democratic regimes that are threatened by protest movements that are used to suppress, delegitimize, and otherwise subdue mass mobilization. And unsurprisingly, they involve largely rhetorical techniques like trying to denounce movements as traitors, trying to falsely depict them as promoting violence, and in some instances attempting to actively provoke them into using violence in a way that will help to discredit the movements and their claims of legitimacy. And there are other methods like, targeting specific organizers and surveilling them on social media and other things. And these are all techniques that we're now seeing practiced in a widespread way across all different regime types around the world. So the autocrat's toolkit has now just become basically the anti-dissident toolkit in many places around the world. But movements are definitely fighting back and adapting their strategies to try to anticipate and then counter these types of rhetorical moves. I would argue that, in fact, the current movement for Black lives and racial justice more generally has much more narrative control than previous iterations of racial justice movements over the previous couple of decades, meaning that when attempts were made to depict the movement as a bunch of violent radicals, that was essentially like a dominant conversation for a couple of days, and then it snapped back into the movement's claims, grievances, and legitimacy. And President Trump's attempt to threaten the movement with the declaration of martial law or sending in the military backfired in a major way. And we saw far more mobilization after those comments made on Monday night at a news conference than we saw before them. And the mobilization that we witnessed after was much more broad-based and multiracial than the mobilization we saw before, more peaceful and more insistent on the peaceful nature of the uprising, precisely to counter this claim that the movement was violent. And so what we've seen is that movements now know that these are going to be active attempts, and they have organizational skill, capacity, and discipline that allows them to respond immediately and call for more support from a much broader based coalition than they had access to in the last 10 years. And so the key thing for movements is to maintain these active connections with members of a very broad multiracial coalition, because that in many ways helps to counter these narratives and gives them capacity and numbers to continue keeping up the pressure. And that's exactly what this movement has been doing.
Matt or Arkhan,
Go ahead, Arkhan.
Well, I mean, just to add on a little bit to what Erica said, I think the particular Black Lives Matter protests are just super, super interesting in many respects. A couple of them, one is I completely agree on the narrative control. So it could have easily, like the defund demand could have easily been depicted and used to constructed in some ridiculous way that is not what people intended, but somehow the movement was able to control that narrative and make it about where the money is going and the use of money for basic human needs, and in a pretty interesting and effective way. So they were able to change the agenda, right? Defund wasn't on anybody's public agenda except for Movement for Black Lives a year ago, but now it's on like lots of people's agendas, and it was able to control that in a weird way. And one, I don't know if Erica or Matt agrees with this, but I think of the narrative control as extremely interesting because it's narrative control without narrators. So if you look at CNN or MSNBC, I mean, I don't know if anybody on this call can name a prominent Movement for Black Lives speaker that's in the media, you know, on a weekly basis. And if somebody wanted to claim that role, it would be fairly easy to do. It's kind of a movement choice not to do that, because part of the lore is that in the 1960s, we had nameable leaders, and guess what? They all went to jail or got killed, and we kind of don't want that to happen again. But it's deeper than that. A great book on this, one that I found very helpful, is Barbara Ransby's Making All Black Lives Matter. That is a kind of participant observer account of Black Lives Matter since Ferguson and the ideas that inform it. And it's a very kind of decent, it's not kind of a March on Washington kind of view. And because it's not a March on Washington kind of view, that's why you can have 500 marches and events all around the country all at the same time in this incredibly, I mean, the image that some people in the movement use is a fractal image. It's very kind of decentralized, has a logic that extends throughout, but not in a centralized kind of way at all, which makes it really interesting and powerful, I might add.
Yeah, just to add real quickly, maybe take off my Dr. Doom hat for a moment, because I was curious to see if Erica agrees with me on this. But one area where I see a possible silver lining is that it looks to me like the pandemic has put the populists on sort of back on their heels, because it is the populist nationalists who have failed the most. And, and as a consequence, I am cautiously hopeful that we're going to start to see a movement away from that. And I think, I actually think the BLM protest movement has further facilitated this, because it's taken over in terms of where the primary oxygen is in sort of social unrest, not just in the United States, but in lots of places around the world. I mean, the only, I'm a little more ambivalent about authoritarianism more broadly. If you sort of think about the Chinese model, which is an extremely heavy-handed sort of iron fist from the government, and that also seems to have been reasonably effective. But still, leaving that aside, I think we may actually have seen the zenith of this sort of democracy on its heels and populism on surging. I'm curious if you guys agree with that or not.
I think it's possible. I mean, we have the Poland elections that are happening, where the sort of right-wing populist government is under pretty serious threat. The president in Serbia is facing a massive challenge right now, precisely for using kind of a cynical move to sort of reopen, to show that the pandemic was receding in Serbia, and then as soon as he was elected, shut it down, sparking massive protests because of the cynicism associated with that move. And so I do think there is something to that. But just back to Sophie's question, really one thing I didn't mention, which I'll say really quickly now, is that we've already seen the movement for Black Lives have profound and lasting effects on this polity. For one thing, public opinion has completely shifted in a way that makes that the public is much more sympathetic to claims around the need for racial equality. There is a process that Doug McAdam, a scholar of the civil rights movement, calls cognitive liberation, which is kind of a collective awakening to how bad something is, and a collective decision that we all must participate in order to make the situation right. And you could argue that there's something along those lines happening in the American polity today. And the other way that we've seen immediate but potentially lasting effects is in how many concessions are being made on a daily basis at the local level, within corporations, at the state level, at the national level, the types of conversations that are happening that were unimaginable a year ago. And also, how many people have changed their minds in a costly way. So you'll see, when we kind of look back on this period, it will be interesting to see how many elected officials or people in positions of what we've traditionally associated with power and authority have sort of openly changed their position on many of the different demands that the Movement for Black Lives has been making, and taking seriously certain of these claims. And that's going to affect our conversation for a generation in this country and in many other places. And I think that, an analog to this, which is a much smaller scale event, was the Occupy movement and then the Tea Party movement. Both of those movements have fundamentally reshaped the types of conversations happening in this country and in other countries. They raised issues that every kind of major elected official has to speak to in their platforms one way or the other. And those were way smaller scale. The largest the Tea Party protest got in a single day was tax day of 2009, April 15, 2009. There were about 330,000 people demonstrating on that day. Occupy was probably close to a million or more on a single day worldwide. The movements we're looking at today blow those out of the water in terms of their size, their duration, and their breadth. We have, like I said, over 1,000 events that have happened around the country, the vast majority of them in rural areas where their mayors have said, this is the first protest I've ever seen in my entire life in my town, and I was born and raised here. You know, so we're talking about a level of engagement that this probably very few of us who are on this call have witnessed in this country.
Well, unfortunately, we are out of time for today's discussion. I'd like to thank our three panelists, Matt Baum, Archon, Fung, Eric Chenoweth, so much. Yay, virtually and real.